Hello everyone, I am Dr. Talari. Today I would like to talk about significance of an open-ended question. So first, before I talk about open-ended question, what are the benefits of an open-ended question? 60% of doctors fail just because of lack of time in the exam. They say, I was short of 2 minutes time. If I had one more minute, I would have explained the diagnosis or I would have explained the treatment. So the best way of saving time is asking an open-ended question. So how do you save time? Okay, I'll talk about the example in my next slide, but you will talk less, and English not being your first language, you do less mistakes. And the other thing, you ask the patient to talk, so you will feel more confident and you will have control over the situation. You save energy and you build a conversation, you will be more confident. And the other thing is, if the patient is talking, I will be thinking about my next questions and I will be planning my station. So what is an open-ended question? Okay, open-ended question is a question where you ask the patient to talk more or you give the patient the opportunity to talk. Few examples. Okay, Mr. Smith, tell me about your chest pain. Mr. X, tell me about your tummy pain. Miss Y, tell me about the cough. Tell me about the cough little Johnny has. Something like that. So you give the opportunity for the patient to talk. And how do you save time with an open-ended question? I'm doing an example. And the other thing is, it will be clearly given in the patient's scripts to say, if the doctor asks an open-ended question, tell everything. For example, tell the following: if the doctor asks a question, tell me about the chest pain. It will be clearly given in his in the patient notes. So the patient will start saying, oh doc, the pain started 3 days ago. It was in the center of my chest. Today it has moved to the jaw and arm. It's worse during walking and relieved by rest. I'm also having some shortness of breath with the pain. You need not ask about when did the pain start, where is the pain, is the pain moving anywhere, blah blah blah. You ask all the above questions to get the same answer what the patient said by asking one question, tell me about the chest pain. So you can think, so how am I saving time? You can save time by not asking many questions. For example, each question will take at least 10 seconds. Okay, I'll tell you an example. Mr. Smith, tell me, where do you have the chest pain? Or Mr. Smith, is the pain moving anywhere? So if you ask 10 closed questions, that will take 100 seconds, which is roughly 2 minutes of your very valuable 8 minutes time. So you save patient answering time as well. So you ask, where is the pain? The patient will say, oh, the pain is in the middle of the chest, doctor. And you will ask him again, is the pain moving anywhere? So the patient will say, the pain is moving to my jaw and moving to my left arm. So see, there is again the patient answering time, which will be probably 3 to 4 seconds. Sometimes the patient will think for another 2 seconds and answer because he is not sure, it's not a real patient. So he will have to think what is there in the script. So you waste all this time. And other thing is, you save time by saving the pauses between sentences. Suppose you ask the patient, Mr. Smith, is the pain moving anywhere? Obviously, there is 3 to 4 seconds before the patient answers. So he will think, what is there in my script? And he will say, no doctor, the pain is not moving anywhere, or is the pain is moving to my jaw, or the pain is moving to my left arm. So things like that. So you save a lot of time. I would save at least 2 minutes by asking one open-ended question rather than asking 10 closed questions. So it's very important that you ask an open-ended question. And the other thing, while the patient is talking, as I already said, you can think about your next questions and you can plan your station. And the other thing, you save your energy as well, which is very valuable because the exam is a 16 station exam, and it's a high intensity exam where you have to have lots of energy, because by roughly 10th station you will run out of energy. Trust me, this is true. By 10th station you will not have energy and you will be thinking, 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this station. I just want to get out of this. 'Maybe I will fail this s exam hall. So it's always important that you save time, you save your energy, talk less by asking open-ended question, do less mistakes as English is not your mother tongue, and be confident. I hope this tip has helped everyone, and thank you very much for listening to my video. I'll probably see you in my next video. Thanks again.